video will help answer the question, what is a community health assessment? Every 5 years, the Washtenaw County Health Department conducts a community health assessment, though our most recent iteration was delayed due to COVID-19. In the past, this process was part of the work the HIP partnership did. While the HIP partnership came to an end, we are still doing this work. We simply refer to it as our community health assessment, or CHA for short. This assessment helps us gather information on health in our community. We want to learn about the ways our community is doing great in terms of health and the ways we could improve. The health department uses the information we learn from the community health assessment to help us make decisions about the work we do for the next 5 years. The CHA helps inform our health department activities and programs to make sure they are meeting the needs of our community members. Most health departments across the country do some form of community health assessment work. Here at the Washtenaw County Health Department, we are focused on addressing unfair and unjust differences in health. We value health equity and community engagement in our approach to our CHA. Now let's talk about how we conduct a community health assessment. Our process involves collecting data, gathering stories, and turning what we learn into action. Throughout the process, we collaborate with community members and organizations to guide our work and ensure we are listening to the voices of people who are most impacted by health inequities. First, we look at the data we already have about health in our community. This data is available to everyone and can be found online at healthforallwashtenaw.org. Next, we ask community members for their input. We know numbers don't tell the whole story, so we want to talk to folks to get a better understanding of what they feel about their health and the health of their neighborhood. We want to learn about what things make it easy or difficult for our community members to live their healthiest lives. We get this feedback from surveys, one-on-one interviews, and in focus group settings. We're intentional about talking and partnering with people who face the greatest barriers. Finally, we pull all this information together and analyze it. After analyzing the data, we share a summary about what health looks like for Washtenaw County. These findings help shape the foundation of our health department's work for the next 5 years. The whole CHA is part of a continual health improvement process. There will always be some limitations on what information we are able to include, but we're always working to make our CHA more inclusive to improve our work during the next 5-year cycle. Thank you for your interest in our community health assessment. For more information and updates, check out healthforallwashtenaw.org.